the life cycle. Now see the economic aspect of the aging. So people are economically productive for a limited number of years after college till 55, 60. So we have to earn in this age to take care of ourselves in the future and to take care of other dependent, means our children, ailing parents or other family members. That's what we have to take care. And not only our family, citizens of our country through our taxes, what we have to do. Okay? So this is the burden of longevity, which is going to pull up. It is pulling up actually. So the phase where we are economically productive, we have to be the best. And here again comes the role of anti-aging. Right? Just 2 to 3 decades ago, the prevalent view of aging was highly pessimistic. It was like aging is inevitable, it has happened, forget about it, wait for your death. You have lived your life. Epidemiologists held that while modern medicine could keep older people alive, nothing much could be done to prevent, delay or significantly treat the degenerative chronic diseases of aging. This is what epidemiology people say, that, hey, you modern medicine people, you are keeping people alive, but what do you have for their issues? What do you have for dementia? What do you have for osteoarthritis? What do you have for coronary artery disease in the geriatric age group? Alzheimer's, what do you have? The result would be that more and more older people with chronic disease would be kept from dying, and the chronic disease will keep on piling up. So what is the reason of the prevalence of diabetes going up? Answer comes is lifestyle. No, it's longevity. I am not talking about incidence, prevalence, longevity. Longer, so diabetic people are no more dying with the same rate what they used to die 20 years back. We are not letting them die, right? Even if they come in DKA, we make them live and go back. Even if they come with a gangrene, we amputate them and tell them go back. But what is happening? The pool of diabetes is going up. The number of diabetics are increasing, right? Now what is the answer of that? What is the answer of that? So either you go back the same, don't let them live, or you make them live with a quality of life and being productive and not being dependent. This is the target, even for the health authorities and also for the doctors. But again there is a problem. If they are productive, they will not retire. Resources are minimal. If they don't retire, who will get the job then? Lot of complications. So whether they are economically productive or not, if we can do something, so they are actually physically not dependent, probably we can help them, or we can decrease the load of the complications of the chronic disease, maybe we can help them. So when we talk about anti-aging, we always think about the financial aspect of it, social aspect of it, the load on the nation of it, and also on an individual of it. Our population will be in a good position, our age group. The age group in 40s today, I'm not even talking about less than 40, so 40s and early 50s, they have prepared for their old age. So they are saving, they are putting in their whatever mutual fund and all, every day some advertisement comes, acha hai, right, something like that way, something like that. So people are putting in mutual funds, people are putting in their investments, insurance people are doing, medical insurance people are doing, life insurance people are doing. So they know retirement plans they are taking. So their retirement they are planning. And they are going to be the best candidate for anti-aging treatments and all. Right now we are talking about anti-aging prevention because they are not able to afford a lot. But when our population will reach there, when I reach 55, 60, I will have enough to take care of me for next 20 years and do everything what I want. Everyone will become Salman Khan and Shah Rukh Khan, and because they can afford it. I can get my Botox, my fillers done, I can get the swanky thing, I can have my earrings, I can have my glares. I can afford, I don't have to ask anybody because I have saved for it. But the population which is today, they have not saved it. Second is, they had a huge load of dependent on them because they had 5 children, 6 children, 10 children. Now we have 1 or 2. How many of us have more than 2? Personal question. More than 2 children I am talking about. How many? Anybody having more than 2 kids here? Nobody. Okay, 1 kid. How many of us having 1 kid? How many of us are married? Okay, I'm sorry. I think ulta question again. So I am married. So it's the ulta question. All of us are married, right? So 1 or 2. We don't go beyond it. So we don't have. No, still those 2 are very expensive, undoubtedly. But still, no, but the other expenditures are not there. No, marriage and all India, they are big expenditure. They will sell everything for the marriage. And I know a story of a stem cell therapy provider